Hello everyone and welcome. In this presentation, we'll review a fascinating theriogenology case reported in the Journal of American Veterinary Medical Association involving a 6.5 years old sexually intact female English Springer Spaniel examined for post-Estral vulvar discharge. We'll discuss the history and clinical presentation, the diagnostic approach, the differential diagnosis, and the final diagnosis and outcome. This case offers an excellent review of how to differentiate among common causes of vulvar discharge in bitches. The patient was a 6.5 years old intact female English Springer Spaniel presented with orderless green vulvar discharge beginning 19 days after the onset of proestrus. Before that, her discharge during proestrus and estrus was typical. She had previously whelped successfully but was not bred during this estrus. The owner noticed mild depression, typical for this dog at this stage, but no changes in appetite, thirst, or behavior. Because of the bitch's age, the owner was concerned about pyometra. The referring veterinarian found normal vital signs, temperature, pulse, and respiration were within the normal limits. Moderate brownish discharge, which was odorless. Vaginal cytology showing 50% cornified epithelial cells, few neutrophils, and many cocci. Culture revealed a mixed population of normal vaginal flora with no prominent pathogens. CBC results were normal. Treatment with amoxicillin clavulanate had been started empirically and the dog was referred for further evaluation. At the university hospital, physical examination findings remained normal. The bitch was bright and alert. There was small amount of odorless tan discharge. Abdominal palpation was unremarkable, no uterine enlargement detected. A vaginal swab was obtained for cytology using Grabanowski stain. Microscopic examination showed a mixed cell population including cornified epithelial cells and neutrophils. The clinicians considered three main differentials for this cytological pattern: early diestrus, pyometra, vaginitis. Let's look at each one in turn. The first one was the early diestrus. During proestrus, we see progressive cornification of vaginal epithelial cells. In estrus, nearly 100% of the cells are cornified, often anuclear. Then at the onset of diestrus, there is a sudden sloughing of these cells and the influx of neutrophils, a normal physiological inflammation due to epithelial turnover. This transition usually occurs about 17 to 20 days after the start of proestrus, exactly matching this bitch's timeline. The second differential was pyometra. Pyometra is an acute manifestation of chronic cystic endometrial hyperplasia, typically affecting older bitches with a mean age of around 7 years. It usually appears 4 weeks to 4 months after estrus when progesterone dominates. In this, the cervix closes, uterine contractions are suppressed, endometrial secretions accumulate promoting bacterial growth. Clinically affected dogs often show foul-smelling sanguinopurulent discharge, abdominal distension, polyuria, polydipsia, and depression. The third one was vaginitis. Vaginitis can occur both in spayed and intact females, often presenting with mucopurulent discharge and vulval leaking. Causes include anatomical abnormalities, urinary tract infection, or idiopathic inflammation. However, this bitch had no urinary sign, no predominant organism on culture, and no local inflammations. Based on the timeline, cytological findings, and the absence of systemic illness, the final diagnosis was early diestrus, a normal stage of reproductive cycle. No further treatment was necessary. The vulvar discharge resolved within 1 to 2 days after admission, and the bitch was discharged with plans for further breeding during her next discharge. This case highlights several key points. Cytology is a powerful diagnostic tool in canine reproductive medicine. Recognizing the normal cellular transitions between estrus and diestrus can prevent unnecessary treatment or surgery. Green mucoid discharge does not always mean infection. Context and cytology are also essential. Pyometra remains a major differential in older intact females, but diagnosis should always rely on complete clinical picture including blood work, imaging, and cytology. Client education is also vital, reassuring owners that not all discharge is pathologic. Thank you for watching. This case demonstrates how careful clinical reasoning and cytological evaluation can differentiate between normal physiological processes and pathological reproductive disorders in bitch.